Hey guys, so before we get into the video, I was reading comments on one of my recent videos and you guys were saying that it was like the music was taking over my voice, like I was trying to talk over it, and I was like, y'all crazy, because I edit my videos and it doesn't sound like that. But I edit my videos before I save them on my editing system, and I decided like, alright, something's going on here, let me play it on YouTube and see what's going on. And when I played it on YouTube, it was like the volume of that music went up like 30%. I don't know what happened, but what I figured I would do is right now, like as I'm speaking, as I'm giving my intro, the music will be playing, it'll be fine, and you know, I'll do my intro like, hey guys, today's video is going to be about things they don't tell you with ostomy surgery. And then when I say, let's get into the video, the music will cease. And that's how we'll do it. So hopefully you guys think this is a better idea, and then maybe I'll play some music at the end, but during the actual content, we will have silence because I don't want my voice to be taken over by beautiful piano music, which I know you guys definitely love my voice more than that. Alright, let's get into the video. So there were a number of things that I was not told about my ostomy surgery after I got it. Things that would have been nice to know about, but instead I kind of just had to learn on my own. So I came up with a list of things that either I remember learning about and being kind of surprised about, and a list of things that some of the kids have asked me about in the hospital right after ostomy surgery. I think this will be a good summarization of information, very general, but just kind of like a warning. Like, hey, this might happen, or expect this, just so if anybody is facing ostomy surgery, or maybe you are sitting in the hospital right now and you just had surgery yesterday, maybe this will help you out a little. Alright, the first one is kind of the funniest one, and the one that I have definitely gotten the most questions about. Ostomies or stomas make sound. I have been there for 2 kids right after their ostomy surgery, and we're like just chatting or whatever, and I'm giving them some information when all of a sudden their stoma is like, you know, makes whatever noise it makes. That sounded like a cat, so stomas don't really sound like cats, but anyway, they would be like, what was that? What was that? Was that my ostomy? And I'm just sitting there laughing like, yeah, this is it. This is what you're gonna have to deal with. But yeah, they make sound. So basically the noises that your stomach, like your skin and your muscle and your subcutaneous tissue, all that nonsense, all the noises that your intestine makes that are muffled by all of these barriers, you don't have them anymore because your intestine is coming outside of your stomach. So all you have is a thin plastic bag, basically, blocking the sound. So it doesn't really work. So it does make sound, and they make plenty of like muffling products. I've just found, you know, I kind of feel when it's gonna make noise, so I just, you know, put my hand, I kind of stand like this. Like, yeah, da-da-da-da. My bag is like hanging out of my shirt, whatever. Stomas also move. You know, intestines have this thing called peristalsis, which just kind of moves the food down your intestines, so it's moving. If you ever take your bag off and just stare at it for a few minutes, you will see it move. It's kind of cool. They also bleed. They have a lot of blood flow into them, and that's okay. That's what we want. But sometimes just the lightest touch will cause it to bleed. It's not a big problem. It's, you know, no emergency or anything. Just be very careful when you're touching it. And the other thing that people find surprising about stomas is that there are no nerve endings, so you actually cannot feel when something is touching your stoma. Now, you may feel the skin around it, you might feel some of the tissue inside, but if you were to just touch your stoma, you would have no idea, like you can't feel it. This leads into pain after surgery. So when you're thinking about it, you're looking at your stomach and all the scars or wounds that you wind up with. Usually they try to do ostomy surgery laparoscopically, so you have the smallest incisions and you're probably thinking, okay, so probably not a ton of pain associated, with ostomy surgery. And what you have to remember is that our intestines are not just kind of sitting in our abdomens. They're not just flopped in there, you know, able to move wherever. There's tons of tissues that grow together attached to your like peritoneum and all of that. I don't know the exact science, guys. I'm terrible with anatomy. But there's all these tissues connecting the intestines so they're, you know, not just moving around willy-nilly wherever they want. They're all healed together. When you wind up getting ostomy surgery, particularly if it's done emergency and they need to clean you out and all that, they have to rip these tissues apart. So what seems like what would be a local pain winds up being a general pain throughout your whole abdomen, because they do have to move the intestines. So it sort of feels like, the best way I can describe it, it feels like I just did the most intense ab workout. And you know, your whole abdomen is in pain. You're like, this doesn't make sense. Like, all I have are these 3 little incisions and then a stoma. That's essentially why. They had to move your intestines all around, tearing all these tissues. So that's why the pain can be a little bit more intense than expected. I often get the question too, how often do you empty the bag and how often do you change it? So that is one of those things that totally depends on you. Usually when you first get ostomy surgery, your intestines sort of go to sleep. They're not active, and that's one of the reasons they won't let you eat until your ostomy starts having output. They want to make sure that your intestines are having the peristalsis to move food through. Now, the first few days, it can go either way. You might have a ton of output and it'll be very watery, and that'll require you to empty it, I don't know, 10 times a day, or not much might be coming out. You might be a little bit slower to wake up, so you might only have to empty it twice a day. It totally depends on how your intestines react to surgery. Now, after a while, when everything heals and your body has become used to having the bag, you'll learn how many times you have to empty. Now, personally, I empty about 5 to 6 times a day, but I know other people who empty more, other people empty less, so it totally depends on you. Changing the bag also depends on you. I know some people, we have one patient that gets maybe like 4 hours worth of time out of one bag and flange. There's a lot of other issues going on with that person, but for myself, I get 3 to 4 days out of a bag. In the past, I've got a maximum of 8 days out of a bag without having to change it. So it depends on how good a seal you want, and how good a seal, you know, you can get. What kind of bags you use, if you use a 1-piece and 2-piece, it really depends on you too. But I would say that the average time is probably around 3 days to get out of an ostomy bag. The other thing that we have to think about when having an ostomy is dehydration. So typically, it depends on what kind of stoma you have. Now, if you have an ileostomy, that means that your colon was completely, it might not be removed, but it's not part of your digestive system really anymore. And the colon is what absorbs most of the water. So when you're just working with the small intestine, which absorbs a small amount of water, you really have to drink a lot more. And I really like Pediasure and Drip Drop for when I'm not, when it's like summertime and I just feel like I'm not getting enough water. I love using that to at least get the electrolytes and try and help myself out. If you have a colostomy bag, that can be totally different. You might have enough of your colon to absorb more water than us with ileostomies have. And sometimes with colostomies, the output is so thick because the water is being absorbed out of it that you have to irrigate. And that's something that, I'm gonna be honest with you guys, I have no experience. I remember watching a few videos the first day of nursing school, and then since then I have not dealt with any colostomy bags. All of the ostomies I've seen are ileostomies. So just remember, you're going to have to drink a lot more water with an ileostomy than a normal person with a colon has. Another thing that I think we forget about when we are in the hospital getting these surgeries done, we have to think about the supplies that we're going to need when we get home. In the hospital, there are usually unlimited supplies of ostomy bags and all of that stuff, but you don't really think about what happens when you get home. So what you have to do is find a company. I can name two for you right now. The two that I have used are Edge Park and McKesson. I've heard that people have a lot of trouble with Edge Park. I don't remember why I switched. I think it was because McKesson was based in the next town over, so I could order supplies and pick them up the same day. I think that's why I did it. But Edge Park is one that you can do, and then McKesson, which was, it either was or is Sterling Medical now. I can't remember what their current name is. I think it's McKesson, and they were Sterling Medical. I use them and I have no problems. I really like them. But you have to make sure that your insurance is going to be able to cover your supplies. I think a really great idea too is that when you're in the hospital, they kind of, usually hospitals pick one company that they'll like get bags from, and the patients are kind of limited to those bags. You got to remember, there are so many different ostomy bags out there. You have so many options that I think if you are going into the hospital knowing you will leave with an ostomy bag, go, like, just Google ostomy supplies, look at all the companies, and order samples. Every website, I'm pretty sure almost every website has a free sample form. You just write in what kind of ostomy you have and your address and your name, and you'll be able to get samples. Not only does that kind of give you supplies while you're home for those first few days before you can get things figured out, it gives you the opportunity to try all different bags because you are not limited to what your hospital gave you. Another question that I get a lot is, can you exercise? Can you do sports? Yes. Yes, you can. So when I first got my ostomy, I was playing soccer and I was really worried I wouldn't be able to go back. And I found out there was absolutely no issue with me going back to sports and exercising. They make support belts and they make protective belts. Now, the only concern after you have ostomy surgery where your abdomen has been technically cut open, there is concern for hernias. And when you put stress on your stomach or your abdominal area, it kind of increases the risk for a hernia. So that's why I personally limit what I do with my stomach. I don't like putting a lot of pressure or a lot of stress on it, just because I don't want to deal with a hernia. And that basically is when the intestine kind of pokes through the abdominal wall, like through a hole, and you know, you've been cut open, so you've got these holes. Now, they do make supportive hernia belts and they make protective belts for the actual stoma. So if you were to play sports like soccer and somebody decided they wanted to kick you in the stomach, you'd be good, because you've got your protective belt. Which, you guys, if you've ever looked at any of my old videos, I have a lot of videos. Companies had sent me a bunch of different belts. I did a photo shoot with one company, and there's like a ton out there, and I have reviews on all of them, so you guys can look at those if you're interested in getting a belt. But you should not feel limited because of your ostomy unless you are like a super ab workouter. If you like to do sit-ups, maybe that would be an issue, but it's something that I would talk to your surgeon and talk to your doctor about and see if there would be any increased chance for you getting hernias. Yeah, that's kind of my thought on that. And the last thing that they might not tell you, but you might have available to you, is a stoma nurse. So there's something called a WOCN, Wound, Ostomy, and Continence Nurse, which is what I want to be eventually. But this is a nurse whose sole purpose is to deal with your wounds and your ostomies. Now, there is that third component of continence, but some RNs will drop that, like they don't get their certification in that because they're just interested in the wound and ostomy side. But basically, their sole job is to help you with your ostomy. So they can help you with skincare, with making the bag stick, basically anything you can think of dealing with an ostomy. And they are fantastic. You might see them in the hospital before you leave. They might do your teaching with you. But they also have home care, and they can come to your house when you're having issues. You can call them up and say, yeah, my bag ain't sticking. and they'll be like, okay, I'll be over in 10. Just kidding, that's not really how it works. But they will come to your house and help you change your bag. And my Ostomy nurse, I can't remember her name, but I remember having one. I think I was still like kind of drugged out on pain meds, but I definitely had one, and she helped my bag stick to me when my skin was like this raw, red, weeping mess, and she was awesome. So they do have that available, and it's something that if you're interested, definitely ask about it, because you might be able to get them to come like to your house and help you. Okay guys, those are all the things that I can think of that I was wondering about when I first got my ostomy, and I'm hoping that this helps you. I know it can be a very emotional time getting an ostomy bag because your whole life is changing, but these are just some things to maybe expect, so you aren't going into this being surprised at every step of the way. And then at the end of this video, after I say goodbye, I'm going to show you what just happened, my excitement for this week. I'm so excited, yay! Alright guys, I will see you soon, okay? Bye! It's so pretty! Oh my gosh! My new car, guys! Look at that! Ah! And then the empty spot next to it where the beetle had died. But look at how nice it is! Oh my gosh! It's giant, so I'm gonna feel like a tank on the road. I think it might be locked, yeah. But it's so pretty!